Welcome to the Great Girlfriends podcast, where we discuss life, love, laughter, and everything in between. I'm your host, Sybil Amuti, and I can't wait for you to hear all of the Great Girlfriend magic on today's show. So without further ado, grab something great to drink, grab your pen and your paper, and get ready for this week's episode. Enjoy! Great girlfriends, I'm so excited to have you join in on a conversation that's taking place with myself and Dr. Ada Stewart, who is a family physician with Cooperative Health in Columbia, South Carolina, and board chair of the American Academy of Family Physicians. Dr. Stewart, as board chair, advocates on behalf of family physicians and patients to inspire positive change in the U.S. healthcare system. She's also been a practicing family physician with Cooperative Health, formerly Eau Claire Cooperative Health Centers, since 2012, and currently serves as a lead provider and HIV specialist. This conversation is very important as we get to know the facts about HIV. We kind of dispel some myths that have been plaguing our community for so long, and we gain a new understanding of how we can be more proactive and preventative in protecting ourselves from HIV, but also creating a sense of care in our community around the topic of HIV. So do enjoy, take notes in this conversation, and get prepared to learn something new. I can't wait to hear what you think. I'm incredibly honored to have you on, Dr. Stewart, as we've partnered with HealthyWomen with support from Merck to bring up these very important conversations, this one specifically around HIV diagnosis and treatment. And I know that you are the woman to give us all the answers we need.
Awesome. Thank you. I am so honored.
So before we jump into the nitty-gritty of what we're talking about today, I got like a lightning round of questions for you, just for us and my listeners to get to know you a peek better. Is that okay?
That's fine. Thank you.
What's the song that gets you going in the morning?
Oh my goodness. So right now I have been listening to Kenny Lattimore's Destiny. And that just gets me going. I start running. I run every morning. And that is like my go-to song at this time.
Wow, I love that. Okay, Kenny
Yes.
Lattimore's Destiny. Perfect. We're gonna check
Yes.
that one out. Okay,
Okay.
absolute least favorite vegetable.
Oh my goodness, I love vegetables. I would say my least favorite would be, least favorite. Uh,
The one you pick last.
yeah, the one I would pick last, I would say probably cauliflower.
Oh wow. Okay, so this cauliflower movement, you're completely like not a part of it. Like,
Yes, just it's I love vegetables, but that one will be like the last one on my list of ones to choose from.
okay. All right. If you had to live in one place in the world for the rest of your life, one place you got to live or you had to live in one place for the rest of your life, what country or what city would it be and why?
Oh my goodness. I would say my favorite city would be San Diego, California. And I'll tell you
Mm.
why. The weather is just unbelievable. I love it. I moved from Ohio to South Carolina because of weather. So weather is really important to me. And
Mm-hmm.
there in San Diego, there is just so much to do. And I have some of my best friends that live there. And so it would be, just my dream come true. Is very expensive, so I try to kind of avoid it. But it is
Mm-hmm.
my dream place that I would love to end up living at some point in my life.
Oh, I understand. It is truly a dream. My family lived there for 6 months back and forth between San Diego and New Jersey. And
Wow.
when we got back to New Jersey, we missed every moment about San Diego. We really,
Yes.
truly love that place. It's just such
Yes.
a beautiful place, beautiful people, weather's perfect.
Hmm.
It was just, yeah. So I understand it. And I'm going to pray that you get there. I'm going to pray maybe
Amen. Thank you.
your vacation home, or you never know, like how life will lead you.
Yes. Yes. So
Yeah.
true.
So let's get into HIV. For those who are listening who are unfamiliar, tell us why this conversation is important, not just to people who have been diagnosed with HIV, but those of us who are friends, caretakers, or allies to people who have
Mhm.
HIV.
Mhm. It is really important that we talk about HIV. Uh, it is a disease that is impacting so many individuals. And it doesn't have a person or age or a sex that it is, that it just impacts. It impacts
Hmm.
so many people. I tell many, it doesn't matter what color you are, what age you are,
Hmm.
what race, ethnicity, it can impact you. Some individuals more than others, but everyone has someone who they may know who lives with HIV, who is suffering, or it is just a, something that now we really need to talk about because we have prevention. Many
Hmm.
years before it was just, oh, don't have sex, or, make sure you use condoms. Now we have medication to help individuals not acquire HIV. And so it's important that we elevate that conversation around HIV and remove the stigma. I always say
Hmm.
we have to make sure that we normalize this topic so that we're
Hmm.
able to talk about it.
Hmm. Hmm. So for myself and for anyone who's going, I think I know what HIV is, but I'm not really sure. Can you
Mhm.
give us like a clear definition or picture of what exactly HIV is?
Yes, so HIV is called human immunovirus, and it is a virus that unfortunately does not have a cure. So individuals who acquire HIV end up living with this disease. I can tell you from when I first got into the space of caring for individuals who had HIV, it was noted as a death sentence. People just
Mm.
dreaded, that diagnosis. And now
Hmm.
with recent advancements in screening and treatment and diagnosis, it is now considered a chronic disease. So just like we talk about diabetes, we talk about high blood pressure, we need to talk about HIV in those same spaces.
Hmm. So very different from all the stigmas that I recall hearing growing up and conversations in college. And I think I can say from the outside looking in, there has been a progression in conversation and awareness just around, life expectancy,
Mhm,
ways to love or to even treat the disease, whether or not it was a death sentence or whether or not you could manage, even the price of medications around it.
mhm,
I grew up in the 80s, so I was there, when Magic Johnson made his announcement, right? And that
mhm,
was just like,
mhm,
what does this mean? What is this? And
mhm,
so
mhm,
um now you're hearing about it at a higher frequency. I do think that even in that announcement kind of opened the door to us having conversations. But they were all very much this person has the plague, right? And
mhm,
this yeah. And so don't touch, don't drink after them, don't hug too close. There were all of these stigmas that came along with it because the public was so miseducated and ill informed. And so how do you think that the diagnosis and even like awareness or treatment has changed? What's happened from your side of things?
Oh, what has really helped us is the advancement in treatment.
Okay.
Um, Treatment now is been number one, we're able to screen a lot faster, get individuals rapidly engaged in medication. The treatment has been simplified. We used to have where individuals were taking five, six, seven different medications, had bottles all over the place. And now we have things like one single, what we call single tablet regimens, one pill with
Wow.
numerous medications. We even have a long-acting injectable that is out there. And so we have great treatment that's safe, effective. Individuals are becoming what we call undetectable, meaning you cannot find that virus within the blood work. And so, as we talk about spreading HIV to individuals, we need to talk more about what's called U equals U.
Okay.
Undetectable means untransmissible. So we have this,
Mm,
yes, we have this great treatment that is out there. People are now becoming undetectable. So the chances of spreading HIV is zero.
wow. And for me, say that again. U equals U. Is that what you said?
U undetectable
Hmm.
equals untransmissible.
That's powerful.
So
Okay.
if you are undetectable, if you are taking your medication, so again, trying to really put that emphasis on treatment. We have
Hmm.
great treatment out there, and we need to encourage and make sure that anyone who is diagnosed with HIV is treated and become undetectable. So the chances of them spreading HIV to their partners, to anyone, is
Mm,
zero.
that's big. That's very big. So that
Mhm.
really can give a sense of ease. It
Yes.
also, right? It creates more, I guess you could say it creates more connection for people because,
Mhm.
right? Okay, so I'm like, what are these indicators are really, really strong in terms of how you continue to build relationship, have a sense of ease, and also understanding for one another.
Yes.
Okay, so who's at higher risk of getting HIV? Now, I'm gonna tell you, I've heard some rumors. Do you want the rumors or
You can tell me the rumors and then I'll tell you what is real out there.
okay? Rumor is, word on the street is that this is just rumor now, okay? Is that African Americans, like I would say 65 and over, particularly like that elderly community, are at risk or getting HIV at a higher rate. That's what I heard. Don't shoot me down. Is it true?
So right now, the individuals who are at higher risk are men who have sex with men, especially Black
Ah,
men, Hispanic, Latino, and usually that population is the young adolescents. And that is
hmm.
sadly followed by Black women. Now,
Wow.
when we talk about that elderly population or that more mature population, as I try
Hmm.
to call those individuals who are over 60, those individuals are acquiring HIV at a higher rate, but not as high right now as we see our young adolescents. And most of that is due to, risky sexual behavior. And sadly, men who have sex with men just, that's that higher group.
So,
And then as we see women, most of the Black women who follow that high risk group are heterosexual women who are
wow.
acquiring it through heterosexual sex. And so I still hear individuals talk about, the down low. And I was like,
Hmm.
okay, that's old
Hmm.
school.
Hmm.
But recognizing that again, individuals, if you're sexually active, then you are at risk of acquiring HIV if you're not on any kind of prevention. But you have to realize that the community in which you're living, whatever that prevalence is, we know within Black communities that many of the women, usually their partners, sadly, because of the racism and discrimination that we have within our community, we see more men who have been incarcerated,
Hmm.
and that's not necessarily, what we would call, that group of men who have sex with men, but recognizing that just, that population of individuals who more women are having sex with tend to have a higher rate of acquiring HIV.
Wow. Okay, so let me back up. When you say uh men who have boys or men who have sex with each men, boys, and you say
Mhm.
adolescent age, what age are we talking? risky? What age range are you
Yes,
speaking?
I mean, right now we're seeing as low as 13. So usually about
Wow.
15 to the 30s are those who have a higher rate of acquiring HIV. But remember, with our screening recommendations, we're screening all the way to age 13.
Oh my goodness. Okay.
So we
And
must
so,
not forget, our young population.
and then when we talk about women, what age range are you speaking of when you speak of African American women?
Now, usually with African American women, that age range, in the 20s and 30s and 40s. So that's a little bit higher.
Okay. Okay. Oh my goodness. I don't know if we know this.
Yes, yes.
Wow. Okay. So I heard another rumor is that the rate of new HIV infections among Black women is 10 times that of white women and 4 times that of Latina women. Is that
Th-
true? And why,
That,
if it is?
yes, so that is true. Unfortunately, there are many factors, and I talk about this so much within my practice as I, encourage women to get tested. Sadly, Black women are more likely to experience poverty, lack of
Mm-hmm,
access to health care, lack of health insurance, not being able to attend their medical appointment due to not being able to get time off. And we saw this, during the COVID-19 pandemic as well. Not having the ability to get childcare, what we call competing priorities, work, childcare, caring for everyone else except for themselves. That's a
mm-hmm,
big issue,
mm-hmm,
not having clinic time for, those individuals who do work,
mm-hmm,
transportation. And I see, these are things that I see every day. We don't talk a lot about this, but we hear a lot about medical mistrust and distrust, especially within the African American Black communities. We talk about Tuskegee, with the
mm-hmm,
syphilis issue. Henrietta Lacks, we're hearing more about,
mm-hmm,
what happened with her in those cells. Dr. Marion Sims and the, performing GYN surgeries on women without anesthesia.
mm-hmm.
And so Black women tend to be, a little bit suspect of the medical establishment. So when we talk about side effects, I don't want to be that guinea pig. What is this
Mm-hmm.
going to do to me? What is this going to do to my body? Um,
Mm-hmm.
Intimate partner violence, not being able to negotiate condom use. I mean, the list goes on and on, low self-esteem. One of the other things that is we talk about, those groups that are at higher risk of acquiring HIV and then, Black women, most of the marketing around HIV and even around prevention was towards men who have sex with men. And so now we're trying to change that narrative and try to include women because we see now that they are up there as far as, being more vulnerable to
Mm-hmm.
acquiring HIV. And I had to catch myself because I hate that word risk. And
Mm-hmm.
when
Mm-hmm.
you talk to women who are in the HIV space, we try not to use risk because that has a negative connotation.
Mm-hmm. Mm-hmm.
It's just it brings that negativity around it, and so we try to use reasons for us to be able to be healthy, and
Ah, that's good.
so we have to change that narrative. And I
Mm-hmm.
love, and I can't say that I'm the one who came up with that, risk to reason, but some of
Mm-hmm.
my colleagues, some of my girls, and ladies came up with that. And I try to use that in my conversations with my ladies that I am talking about prevention and talking about HIV with.
That's so good. I love that. So then when it comes to accessing HIV protection like PrEP, what role does stigma play in it? Is it still that thing where
Oh
we
my
are
goodness.
so Yeah, you go ahead and drop. Yeah, I
Yes,
want to hear from
yes,
you.
yes, yes. So, it is so sad that we still have stigma and discrimination that's playing this huge role in, the HIV space as well as the prevention space. Stigma tends to discourage individuals for being willing to have that conversation around HIV and especially around PrEP. If
Mhm.
someone is on PrEP, that stigma of if you're on PrEP, then you're more promiscuous, or, who are you messing around with? Why are you wanting to be on PrEP? And
Mm.
that stigma is not only felt from the community, but also from the healthcare establishments as well.
Oh,
I have
wow.
individuals who have come to me because they have gone to other healthcare providers and asked about PrEP and were told, no, you don't qualify for that. I don't think you need this medication. You're not, that sexually active. So if the healthcare professions have this, what we call implicit bias and
Hmm.
stigma around
Hmm.
PrEP, then how can we encourage it to not be an issue when we're having these conversations with our patients? So stigma
Hmm.
continues to play a huge role. And one thing that we're trying to do, and what I do within my practice, is try to normalize that sexual health conversation.
Hmm.
When I'm
So
asking
good.
questions about your sexual history, I tell my patients this is something I ask everyone.
Hmm. Hmm.
So I don't care if you're married, if you're not, if you have, we have to have that conversation so that I can better help you to be healthy.
Hmm. I see that. So then, speaking of conversation, all the girlies are going to want to know at this point, what do we do? We, the sexually active people, okay?
Mhm.
Us. What do we do, and what can the great girlfriends who are listening do? And I want to just get into this really quickly before I ask this question. So many of our listener base are single women, or are divorced and now returning back into the dating
Mhm.
pool. A myriad of different scenarios that are taking place, and so it really does matter when they start when. And actually, I shouldn't even say it that way because even in marriage, I am married, and even in marriage you have to be considerate of protecting yourself from HIV. And, we can trust our partners, but then there's also the medical side of being aware of
Mhm.
what can come your way at any time, right? Due to any
Mhm.
circumstance. And so, having said that, what can we, the sexually active people, great girlfriends, do to protect ourselves from HIV?
It's really important that, platforms such as this, Sybil, and thank you so much for, letting us have this conversation, but increasing the awareness around PrEP,
Mhm.
pre-exposure prophylaxis. It is safe, it's effective. It's important that women, realize that they are empowered to
Mhm.
care for their bodies, and this is a way for them to be able to do so. I also encourage women and sexually active individuals to be open to talk to your healthcare provider if they do not bring up that topic about
Mhm.
prevention and about PrEP, to go ahead and bring it up themselves. And if they find that that individual is not receptive or they're not willing to, be able to provide PrEP,
Mhm.
then they need to go somewhere else. So that
Mm.
empowerment and that awareness of what is out there to protect one is really important.
Okay. So just making sure that we understand that that's a question we should ask. We don't expect it to come to us. We are proactive in asking this question because
Exactly.
our body, our experience, our health, right? And so
Hmm.
we have to really be very progressive and forward thinking and uncomfortable, right, Dr. Stewart? Because
Yes,
that's
yes,
not the Starburst conversation. That's really like,
yes.
I hate Twizzlers, so that's a Twizzler conversation for me. But
Yes,
it's
yes.
the uncomfortable conversation that's essential. and
Right,
so
right.
and it can save us from a lot of heartache and pain and stress down the road if we have the education um and the wherewithal to ask things in advance. Yeah, I
Hmm.
love that. So I love that, but when we talk about advocating for HIV testing, um, you know, how often should we get tested these days? You
Yeah.
know, and even we're in our testing, when should we expect results?
Hmm.
What should that experience be like for us? Are there at-home tests now?
Oh,
Clearly you're
yes,
talking to
yes,
someone who hasn't been tested in a long time. It's just me being very
yes,
transparent.
yes.
So I'll be the first to say my hand is raised. I have questions.
Yes, so it's really important that as we talk about the advancements in diagnosis and treatment, the screening recommendations are there. We have recommendations through the CDC. We have recommendations from the United States Preventative Task Force that recommends that any individual who is, well, number one is anyone should be screened at least once in their lifetime,
Hmm.
depending on which recommendations you are looking at. The CDC's recommendations are different than the USPSTF. CDC starts at 13 to age 64, but also remember that everyone even older than that needs to be screened. And then the United States Preventative Services Task Force, their recommendations is from age 15 to 65. And that's just everyone needs to be screened at least once in their lifetime. If my recommendations and others recommend that anytime, and they use the word more at risk, and I try to avoid that. But if you have you change sexual partners, or
Hmm.
you are now single where you were divorced, then more frequent testing is available. Great
Okay.
thing is we have some wonderful testing out there. We can get results within like a few minutes within our offices with a drop of blood. We also have self-testing that individuals can do within the comforts of their own home. Sometimes
Wow.
I say that, for couples, I say, get you all some home self-testing. And before you engage in any activity that's going to be test each other, make
Hmm.
sure that. So, because a lot of times, again, especially in our communities, and then with women, just not being able to negotiate, whether someone uses a condom, or, not having one feel that they are, being judged, etc., then it's best to go ahead and just have a equal playing field. Like, I'm going to test you, you test me. We're both negative. Okay, let's get busy. But
Hmm.
and so we have some options available, and that's one thing that has really improved the opportunity for us to diagnose and get individuals linked into care early, get them treated, get them undetectable so that they are untransmissible.
Wow. This is really good. And for me, I'm the parent of a 15-year-old and a 13-year-old. So
Mm,
we're now in that age that you are
yes,
speaking of. And as parents, I think for you great girlfriends, we're also in that parental stage. Yes, we're thinking of our own health, but we've also got to think about our children and how do we, really kind of integrate these patterns or this awareness into their life very early. You're just giving me some examples of ways that we can start teaching them about sexual health, and that in a different way around testing specifically, which means maybe we all go get tested together. Maybe we
yes.
have at-home tests that we do
Mhm.
on a regular basis, and that kind of introduces them to the idea that this is a routine. This is something they should practice. And it
Mhm.
also opens the door to deeper conversations around activity and things to protect themselves from and things to understand about what's happening in the world, really giving them
Yes.
a real sense of connection to what could be a risk for them should they practice things that would lead them down that path, right? And so
Yes.
um, just for me, it's given me a different uh, a view, different lens on it because as parents, we can be negligent oftentimes in assuming, oh, our kids are good. Our kid,
Yes,
my kid's
yes,
not doing anything that could lead them down this pathway. And it could never happen to me. And you look up and things are happening that you're
yes,
unaware of. So,
yes.
um, I love that idea of what you when you start talking about the age and you start talking about at-home testing and couples testing together, um,
Mhm.
just making it more like almost normalizing as we did with the COVID test in 2020, right? We threw them everywhere. We were
Yes.
just
Hmm.
and I don't think we
Yes.
should have it. It shouldn't be as much fear-based as much as it is awareness-based, right?
Hmm.
Okay.
Exactly.
Okay. Yeah, because I think one thing we had a lot of with HIV over time was we've had a lot of fear, we've had a lot of ignorance, and we've had a lot of sort of just rejection of information. We just didn't want to learn it because we were scared that it could
Hmm.
possibly be applicable to
Hmm. Hmm.
right. And so
Yes.
I think that that's a lot of what's happening. And even if you don't have a symptom, you don't have it or that you could have
Right.
never, yeah. So I do think there's so much for us to learn and know um, that you have just kind of brought to the forefront in such a tangible way today. What's your message to women who are living with HIV, who are working towards solutions? Where would you route them? Where would you say to go and do?
Wow. So, my message every day is to, remember that your sexual health is part of your overall health. You've
Hmm.
got to take care of your body. And I love the saying that your body is a temple.
Hmm.
It's truly a temple. And for those individuals who are living with HIV, who have experience with PrEP, talk to your sisters. Just talk to individuals about your experience, because then sharing of that knowledge, of that experience can help another individual to be able to live comfortably and be able to thrive and survive in this world and realize that HIV is a chronic disease. I tell my patients who are newly diagnosed that this is something just like high blood pressure, diabetes, that long as we take care of your overall health, you take your medications as prescribed, then you will live a long, healthy life. It's important to realize that PrEP as well as HIV treatments are safe and they are effective. And my final word is that, PrEP is not just for men. And I've done
Mm.
lectures on that. Uh,
Hmm.
and because so many times women feel that this medicine is for just men, it's not for me. And so again, having the face of PrEP, the face of HIV, be women who look like us, being able to pass on those messages is really important.
Hmm. Hmm. Well, I want to thank you for being one of those leaders in this conversation and really jumping to the forefront and for the work that you do on a daily basis to educate us and protect us from ignorance.
Yes,
Ignorance is
yes.
also it's a chronic disease. And so
It is, it is.
and your advocacy is changing lives, it's saving lives, it's restoring hope for a lot of people, right? And it's really
Yes.
giving us a sense of we can do it, we can make it for
Mhm.
people who need to know, and for people, which I would say for all of us, but specifically people who are really looking for solutions in real time that will help to protect them and give them a better quality of life through their experience with HIV. So thank you so much for this conversation.
Yes.
I also
And
want to,
and thank you. I mean, just having this opportunity for to impact communities that are so disproportionately impacted is really important. So thank you.
oh my goodness, it's a privilege to shine a light on this information. It's a privilege to have experts to come and teach. right? Because again, I'm on the ignorant side. I'm on the learning side. And so you make me and our audience is a little smarter, a little more educated with every conversation that we can have about this topic. And we can also be better friends, great girlfriends, caretakers, community ally, and advocates, So I want to thank you. And also special thanks to Healthy Women with support from Merck. Healthy Women has been a really wonderful partner to the Great Girlfriend Show. I mean, giving me leading experts across the field. And I am so grateful that their advocacy is so consistent and faithful to the Great Girlfriends community. So thank you so much, Healthy Women. Thank you so much with support from Merck. Thank you, Great Girlfriends, for listening. If you love this conversation, please shoot us a review on iTunes, share, subscribe, and make sure if you have any topics that you want to hear, you email welcome@thegreatgirlfriends.com. Last but not least, Dr. Ada, are you on social media and where can they connect with you?
Oh, I am on Twitter and or X, I'm sorry, X as well as Facebook. And unfortunately, just search me, you'll find me. I can't remember my handle right now, but yeah, or just reach out to me. I'm always willing to speak to others regarding this important and other important topics that impact women. We gotta be that voice for
Mm-hmm.
these individuals who may not feel that they have a voice, and just honored to have this opportunity. So thank you.
Thank you so much, Dr. Stewart. I'm sending blessings your way for a healthy conclusion to your year. We're in Q3, heading to Q4, and I'm just hoping that it continues to be great for you. And hopefully, I'll see you in San Diego. All right, great girlfriends. Did you enjoy this week's episode of the podcast? If so, would you please give us your amazing review on iTunes? Every single review helps another great girlfriend get plugged into the podcast and the community. Speaking of community, make sure you join our Facebook group at The Great Girlfriends, follow us on Instagram at The Great Girlfriends, and on Twitter at @the_great GFS. I'm Sybil Amuti, and I'm out. Peace.